Hello, everyone. On behalf of the Collective Impact Forum, I'd like to welcome you to the final webinar in the series, Getting Started with Collective Impact, presented by the Collective Impact Forum and FSG. My name is Sherry Brady, and I'm Senior Associate for Strategic Partnerships at Aspen Forum for Community Solutions, which is an initiative partner with FSG and the Collective Impact Forum. We have a terrific program today with a great group of speakers, but before we get started, I wanted to touch on a few items so that you're aware of sort of what's happening. Over the course of this webinar series, we have been talking a lot about collective impact, highlighting initiatives, stories, and presenting tools and methods for you to use. We encourage you to sign up for the Collective Impact Forum, which is a free resource for people and organizations to access tools, training, opportunities, and peer networks regarding collective impact. In fact, if you haven't already, we encourage you to tab over to the Collective Impact Forum in order to download today's presentation deck and handout materials. You can click on the box on the bottom right-hand corner of this screen. Today's program is about 90 minutes long, and we encourage you to stay engaged with our presenters by answering polls and asking questions. Periodically, our presenters will ask you a poll like this one. How many people are watching at your location? We'll pause for a moment while you fill in the number into the box. Thanks. Hopefully that was pretty easy for you to do, and those will be happening periodically throughout the call. Other than polls, we would like to hear from you, hear questions and comments from you. Please submit them at any time during the presentation in the box in the lower left corner of the screen. You may also upvote other people's questions. The presenters will verbally respond to as many questions as time allows during the question and answer period. You'll also see a Twitter feed on the right-hand side of your screen. Join this conversation on Twitter using the hashtag #CollectiveImpact. If you need technical assistance during the webinar, you can chat directly with the support using the Tech Support Chat tab at the lower left corner of the screen, or you may use your email to email KRM at custserve@krm.com, and you'll notice it's on the slide there. Last, this event is being recorded, and you will receive the recording link to your email after the conclusion of today's webinar. Thank you again for joining, and I hope you enjoy the presentation. I'm going to now turn it over to John Kenya to get us started.
Great. Thanks, Sherry. Hello, everyone. It's great to be here with all of you today to discuss the process for collaborating with others to create a common agenda. The three key questions we'll be addressing today are, one, what is a common agenda as it relates specifically to collective impact efforts? Two is, what does a common agenda contain? What should we be shooting for, including in our common agenda? What are the key components? And the third question is, how do I create one? What are the typical steps involved in creating a common agenda? So today you'll be hearing from three of us. First, Abby Stevenson, who is my colleague and Associate Director at FSG. Abby has been involved in supporting numerous collective impact efforts, including efforts in child obesity prevention, asthma wellness, and diabetes prevention. We also have with us today Adrian Abate. Adrian is the Executive Director of the Staten Island Partnership for Community Wellness and the Project Director of the Tackling Youth Substance Abuse Initiative, which Adrian will be talking a bit about today, which is a cross-sector coalition aimed at leveraging the power of collective impact to improve health outcomes for youth in Staten Island. Adrian's brings a background from public health program management, coalition building, and community organizing, which I'd say that combination of experiences is about the perfect combination of experiences to help lead collective impact efforts. And you'll also be hearing from me, John Kenya, Managing Director at FSG. Next slide, please. So let's dive into what is a common agenda. Next slide. So the common agenda is the first of 5 key conditions of collective impact. Typically, a common agenda is developed when a cross-sector set of stakeholders who represent different lenses into a particular issue, whether that's education, health, environment, community development, etc. When a cross-sector set of stakeholders come together to define a common understanding of the problem and a joint action plan to hold each other accountable. That's typically how we define a common agenda. A The common agenda is the foundation to the other 4 key conditions to collective impact: shared measurement, mutually reinforcing activities, continuous communication, and the backbone organization. Next slide, please. So what questions should your common agenda typically answer? We think about 5 questions. The first is, how are you going to work together? What are your guiding principles going to be? What are the principles that will guide your work? The second question is, what is in and what is out? Specifically, what are the boundaries of the issue you wish to address? And typically, thinking about what is in and what is out not only requires defining the boundaries, but also putting some level of problem definition together that will help you define the boundaries. The third question is, how you will define success? Very succinctly, what's your goal? Fourth question is, how are you going to split up and prioritize your work? We typically talk about this as a framework for change. And the fifth question is, how will you track progress and learn? What's your plan for learning? Now, not all common agendas, at least that I've seen, include all 5 of these components. Number 5 is probably the one where we see typically least attention paid to. But we think that all 5 of these components are really super important and ideally should be included in a common agenda. Now, the form that the common agenda takes will really vary, and I think it depends on comfort level of the community and the different ways that individuals and organizations and communities want to communicate out on a common agenda. You know, it might be, for example, once it's finished, it might be a 30-page prose document with exhibits. It might be a 40-slide PowerPoint deck. It might be both of those. In many instances, there's a variety of different formats that are used. It comes about as a result of lots of underlying facts brought together and dialogue that takes place. Typically, we should be able to summarize in 2 to 3 pages what the essence of the common agenda is and be able to communicate it to others. Next slide, please. So we're going to be talking you through each of these 5 elements of a common agenda. And a point I want to make, and I hope folks who are listening will take this to heart. When we think about developing a common agenda, there's the content that you come up with, and we'll show you illustrations of the content. And then there's the process for getting this done. The common agenda should not be developed by, say, 3 to 4 people who lock themselves in a room and decide what's right for the community. It really needs to, the development of these 5 items and the common agenda in whole really needs to be an inclusive process of developing these components, and inclusive principally in 2 key ways. One, it should be representative, and folks that are involved in various dimensions of the system. This should be representative of system players cross-sector who touch the issue. So we like to say, if you want to change the system, get the system in the room. You need to have the system in the room in order to actually authentically develop a common agenda that really has the appropriate set of eyes on the issue. It also needs to be inclusive in terms of being representative of the population who needs to live with the results. And so if we want to help the community, let's have the community in the room. So as we think about these items, and we're going to talk mostly about the content of what these various different dimensions look like, although we will sprinkle in some perspectives on process. Keep in mind that at the end of the day, the common agenda is not purely a document that you share with others. It's really the process and the level of thinking that is developed coming out of that is absolutely critical for this work. Next slide, please. So how long does it take to develop a common agenda? First, it's important to keep in mind, and if you could actually build out the whole slide here, that would be great. Thank you. It's important to keep in mind that collective impact, when we think about the stages of what ends up being a multi-year initiative, that there are a couple of different stages that first start with scope and readiness. It's rare that communities can jump right into developing a common agenda. Typically, there are a number of months, and sometimes it's much longer even than 3, as it's articulated here, to determine whether or not the community around a specific issue wants to actually address it through the process and approach to collective impact. But once that readiness is established, then we move into this next stage of what we call initiating action. And you can see the 5 icons here that we showed earlier for the different components of the Common Agenda. This is where the Common Agenda development takes place. And it says 4 to 6 months here. Sometimes a Common Agenda can take as long as a year to year and a half. The exact amount of time it takes is variable, and it's based a lot on local context. A number of the different variables that typically will affect whether or not you can do it in 4 months versus 12 months, for example, is the history of stakeholders working together. If there's very little history of stakeholders working together, it's probably going to lengthen the amount of time that it takes. Another variable, how well defined and understood and agreed upon is the problem that you're seeking to address? Another variable, what's the level of engagement with stakeholders as you're developing the Common Agenda, particularly the community and those that need to live with the results? There's always a challenge in collective impact work throughout all the different phases of work in balancing inclusion versus the pace of actually moving forward. So, a variety of different dimensions will determine exactly how long it takes you to actually develop each of these components. But we are going to actually, go ahead and move into talking about each of these. Before we do that, if we could move to the next slide. We'd like to ask you to respond to a poll here, which is, where are you in the development of your Common Agenda? So if you could select an answer to that, we'll be able to get a sense of where the group is that's listening. And I'm actually looking at the results as they come up, and it looks like over 50% of you on the phone haven't yet started the development of the Common Agenda. There looks like another large share of you, say 45% or so, are in the process of developing a Common Agenda, and 5 or 6% of you have actually completed the Common Agenda, according to the results of the poll. So we have a fair amount of you on the phone that either haven't yet started the poll or are in the process of developing your Common Agenda. So that's cool, and it's great, and we will try to target the majority of our comments to that. Although, for those of you who have already completed your Common Agenda, please feel free to wade in with observations in the chat that we can respond to as well. So with that, I'm going to turn it over to Abby, who's going to talk first about how to set guiding principles.
Great. Thanks, John. So I'll be starting by talking a little bit about each of these elements, and in particular, what I'd like to share is a bit about why each of these parts in the Common Agenda process is helpful to steering committees as they're launching collective impact efforts, and then a bit about how we've seen groups develop each of these items. We realize that there's no one way to go about doing this, but for those of you who are in the process or are about to embark on the process of setting a Common Agenda, we'd like to give you just some hints or some stories from that we've seen work for other groups as they're making these important decisions. I'll talk through the first 3 of these elements. So we'll talk through guiding principles, problem definition, and goal, and then we'll be pausing to take your questions at that point. But feel free to keep putting your questions in the chat bar until then. So guiding principles. We find that guiding principles tend to be one of the first decisions that a steering committee makes together. And it's really an opportunity for a group to decide how they want to do their work together, even before they decide what the work will entail for them. So in particular, we think that guiding principles can help the group promote their shared values. So it's an opportunity for them to make explicit what they all carry implicitly about why they're involved in this work. The second, it's an opportunity to set some rules of engagement. We think that the guiding principles can help the group decide what they will do and what they won't do as they go forward in future decisions. In particular, we find that once guiding principles are set, they can actually be a reference point as groups go further in the process of developing their Common Agenda. They can reference back to their guiding principles and say, oh, yeah, we have a shared value about how we're going to go about doing this, and that will inform this future decision. Third, we think it's often helpful for people who are developing their guiding principles to draw upon the best practices for collaboration that they have seen work previously in their community. So we often ask people to think about when has collaboration worked especially well in your community and your experience, and ask them to bring that lens into developing their own guiding principles for any collective impact effort. So we want to make this, show you some examples from a few collective impact efforts of their guiding principles. This first one is called Unidos Contra Diabetes. It is a diabetes effort in the Rio Grande Valley of Texas that I had the privilege to work with for about the last year or so. And in defining their guiding principles, they set the following principles. The first one was to serve the whole community through a systems-oriented approach. What that meant for them is that they wanted to make sure that they weren't just targeting the individual and their healthy or unhealthy behaviors, but really thinking about the systems in which that individual makes decisions about their health. So that is to say, while they were looking at diabetes, they didn't want to be only thinking about diet and exercise at the individual level, but thinking about the built environment within their community, thinking about the cultural context within people make decisions, thinking about food systems, et cetera. So they really wanted to take a holistic approach to the problem. It was also really important to this group to take an asset-based approach. They said, we will view all families and individuals as assets to build upon and avoid shaming people for poor health. So these two together, I will let you read the other two, but these two together helped set a context for their work together. And in particular, this idea of not shaming individuals for their scenario was, for their situation and health, was a way for the group to then orient their future work and make decisions about how they were going to define the problem, what working groups they were going to build, etc. A second example of guiding principles comes from South Dallas, and this was a neighborhood-level initiative in one of the poorest sections of South Dallas, and it was an area in which you could say it had a lot of efforts or collaboratives that had been done to the community, if you will, rather than sort of done in participation with the community members. So in setting their guiding principles, you will see as I go through them that many of them address how they're going to work together and the involvement of community members. So, for example, they said that one of their guiding principles was that it would be resident-led and community-owned. They also set a guiding principle about respectful communication, which was how they were going to communicate with each other within the context of steering committee meetings. And by eliciting and then defining these guiding principles as a starting point, this group was able to establish trust among their members and really allow people to get excited about being involved in this effort because some of their concerns about how they might be treated were allayed through this process. So in general, on the guiding principles, I think that they don't have to be particularly fancy. Often this is one phrase each, but they're a critical part of starting the common agenda process that can really help lay the groundwork for the other aspects. The second aspect of the common agenda is problem definition or boundary definition, and they are really one and the same. And what this means is that a group comes together and builds a common understanding of the reasons why the problem exists in their community and what are the boundaries around what they will address and won't address. This is the part that I think sounds simple and ends up being incredibly important and complex as you dig into it. So I'll show that by just in a few examples in a moment, but in particular I wanted to say that in defining the problem, it's important that there be some clear boundaries. It can be hard for groups to feel like they're tackling everything for all people, so it's really helpful to set some boundaries on the geography that is the area of focus for an effort, maybe one county, one zip code, or maybe a couple counties. It can also be very helpful to set boundaries around the demographics. Is there a certain age group or a certain type of person that is going to be the focus of the effort? In setting these boundaries, it's really critical to use some high-quality data to inform the thinking and make sure that these decisions are based on data and not perceptions about why the problem exists. And third, and very importantly, it's critical. We have seen that up front, it's acknowledged that these boundaries might change over time. Oftentimes, groups will come together with an ambitious vision, and then they need to have a definition of a starting point, a place where they feel like they can get their hands around a portion of the problem, But it helps those groups stick together if they acknowledge up front that while their starting point might be small, they are building the infrastructure and the relationships that will allow them to tackle similar problems in the future. And so it's important that when you define those boundaries up front, there is an acknowledgement that those boundaries might change over time. So a few examples. I'll again reference back to this diabetes effort that we worked with in South Texas. So diabetes is a problem that affects a huge portion of the population in this area. About 1/3 of adults are either at risk for or have diabetes, and many of them don't know it. So the group decided they really wanted to do a cover 4 counties in their geographic area through this collective effort. They wanted to see, break down some of the fiefdoms between these counties and do a collective effort at that geographic scale. What that meant was that tackling diabetes itself was going to be an incredibly large problem, because that could end up being addressing things like risk factors for people who might one day become diabetic. So that could be things like healthy eating and active living, all the way to managing uncontrolled diabetes. So this group was asked to define the problem a little bit more narrowly on where they wanted to start. And this is really a decision ultimately about whether they were going to focus on diabetes prevention on one side, that's the left side of this slide, or on the far right side, whether they were going to focus on the management of diabetes for people who are already diabetic. So in order to make this decision for the steering committee, what we did is we collected data on each part of this problem. So, for example, we collected data on how often people are screened for prediabetes and how many people have diabetes but don't know they have diabetes. So we were able to bring a host of data about each stage of this diabetes pipeline that you see to the group. And we had a discussion about what are some of the needs and what are some of the opportunities if our collective impact effort was to focus on each one of these components. We then, after discussing the data and identifying some needs and opportunities, allowed the steering committee members to express their votes. This is how the votes came out. And what we saw was a really strong interest among the group of wanting to focus on the left side of the page. You'll see the prevention side of the spectrum. So that was one of the first major decisions that they made together, which was to say that their work going forward would focus on preventing diabetes and target people who are at risk for diabetes rather than those who are already diagnosed. And allowing them to make this problem definition up front was really helpful in then being able to say, okay, what are our strategies and who do we need to have at the table in order to do diabetes prevention? Another example of a problem definition draws from a collective impact effort focused on asthma in Dallas. And to illustrate this story, I'm going to tell you a story about 3 women who came to a steering committee meeting dealing with childhood asthma. They were all really interested in solving the problem of childhood asthma. And prior to the first steering committee meeting, we had actually had a moment to speak with each of them. And in our conversations, we said, why is children's asthma such a big problem in your community? And the first woman, she told us that she worked in a healthcare clinic, and she said the number one problem with why children have so much asthma is quite simple. It's that we have the highest rate of uninsured kids in the nation. So children are not able to access primary care and get the medications that they need to control and to prevent asthma. A second woman joined us, and she was from the Environmental Protection Agency, the EPA. We asked her, why is childhood asthma such a problem in your community? And she said, simple. We have a really high rate of ground level ozone, and it's a major problem. It ultimately results from our traffic congestion, and that's the problem that we need to solve, is the ground level ozone. We asked a third person what the problem with childhood asthma was, and she was a minister from one of the churches in one of the poor neighborhoods within Dallas. And she said, that's simple. The problem that causes childhood asthma is a sense of fatalism about the disease. She said in the neighborhoods where she works, many families anticipate that childhood asthma is a normal part of childhood and don't actually think of it as something that can be addressed and tackled and prevented. When these 3 women came to the steering committee, they all brought special expertise on understanding part of the root causes of asthma, but neither one of them is right and neither one of them is wrong. That is to say that collectively they can build an understanding of the problem of asthma within their community that they might be able to address in a more holistic way that any of them could do while working individually. So in the first couple months of working with them, we had all of these members of the steering committee shared their data and their perspectives on why asthma was such a problem in their community. And together they built this graphic, which shows three elements of asthma. You see on the left-hand side that asthma relies on strong asthma management. And so that shows that the doctors, the nurses, and health educators are a huge part of the solution in being able to help kids control asthma from a medical perspective. On the right-hand side, you see that their initiative that they decided that reducing asthma triggers is a huge important part of that. And that's the role of the environmental regulators, landlords, and even school administrators to reduce asthma triggers in the environment. And in the middle, you see that they said the child who suffers from asthma and their ability to deal with asthma is really built on their sense of self, their knowledge about asthma, their system of support, etc. So together they were able to build a holistic problem definition that sets them up to have a much better understanding of why this problem exists and then what they can do about it. After defining a problem definition, groups can then decide what do they want to set as their goal for their work together. And in setting a goal, we think it's really helpful to choose a population goal that can be measured. By population goal, we generally think of that as meaning for a way of measuring progress among a population of the people who you are trying to affect. And the measurable part of this is also really important. It helps to have something that people will know if you reach the goal or not to drive accountability. Second, the goal should be audacious and inspiring. Setting a challenging, audacious goal can help bring people to the table who might not otherwise because it really excites and motivates the participants of an effort. Also, we've seen increasingly that it's important when setting the goal to consider whether there are equity issues that need to be explicitly addressed within the goal language. To illustrate that, I'll show a couple of examples. So the diabetes effort that I mentioned set the following goal. They said their goal was to reduce the number of new cases of type 2 diabetes in 5 years, such that we cause a 10% reduction in the prevalence of diabetes by 2030. Two things to notice here. One is they have an ambitious goal, a 10% reduction in diabetes, and it's time-bound. They know when they're going to do it. And then they added this phrase, which was really important to them. They said also in their goal, they wanted to say that they are committed to doing this by integrating primary and behavioral health for people at risk for diabetes in our community, with a particular emphasis on meeting the needs of low-income and underserved populations. So they wanted to make sure that in addressing their goal and in reducing the diabetes prevalence, that they were keeping their target population really in mind. A second example goal of a collective impact effort was from the Roadmap Project, and this is an education-focused initiative in Seattle that was interested in improving outcomes for students from cradle to career. Their goal similarly had a target they wanted to double. The thing that they wanted to double was the number of students in South King County and South Seattle who are on track to graduate from college or earn a career credential. They had a timeline by 2020, and then they had an equity consideration here. They said, and the reason they added this last sentence is because they realized in looking at the data that they would be able to double the number of students who were on track to earn a college or career credential by 2020 simply by improving the outcomes of those students who were already doing better off. That is to say, the white and Asian students in their area who were generally those that had higher outcomes in education and in career. They could achieve this goal simply by improving the outcomes of those children. And since they were really dedicated to closing the achievement gap, they added this sentence to their goal. We are committed to nothing less than closing the unacceptable achievement gaps for low-income students and children of color and increasing achievement for all students from cradle to college and career. So with that short introduction to the guiding principles, problem definition, and goal, I will turn it back to John, who will facilitate a Q&A session on these topics.
Great. Thanks, Abby. So there have been some good questions that have come up, and I'll also ask Adrienne. I know you haven't had a chance to speak yet, but if you have any thoughts on these questions as they come up, please feel free to weigh in. So one question is, what's the type or what's the size of the group that's typically involved in problem definition? What's too big and what's too small? Thoughts on that, Abby?
Yeah, it's an excellent question, and this is definitely one of those areas where there's both an art and science to this process. I would say there's no standard answer for what is going to be the right size in the community. What I use as a helpful rule of thumb is saying if we could what is a problem for which we could get a reasonable number of people together and they could make serious progress on addressing that issue. So, for example, steering committees we find typically have roughly between 25 and 30 people on them when they're working very well. That seems to be a manageable size of people. And so if there is a problem for which you feel like you can get the system in the room and have approximately that many people, that tends to be a really helpful size. Now, that might mean if you're looking at a project that has a really wide sort of coverage, for example, that South Dallas initiative I mentioned, they were looking at the health of the entire zip code, from jobs to health to safety, et cetera. So they were really thinking about a broad definition of the problem. So they went with a really narrow geographic scope, just one zip code. On the other hand, if you're going with a very specific and specific problem definition, such as diabetes prevention, you might be able to have a wider geographic scope because you can still get a reasonable number of people in the room and have that system fairly well represented.
Great, thanks. And here's another question. Who leads these processes? And a question goes on to ask, are the comments that you've shared based on the assumption that you have a backbone already in place, or can some of this be done with an outside facilitator?
That's a fantastic question. Thank you for asking that one. So when there is a backbone in place at the beginning of a collective impact effort, they are well positioned to be the ones to help facilitate this process for a common agenda. Otherwise, an outside facilitator can be really helpful in helping these groups come together and go through this process of making these decisions together.
Great. Cool. Another question, and I'm happy to take a first cut at an answer on this. What's the methodology, and I think this may have been asking about guiding principles, but if we just think about these three areas of guiding principles and setting a goal and also problem definition, what sort of methodology do CI practitioners use to develop this? And one that I'll mention, I think there are a variety of ways to do this work. I think at its core, you're trying to bring together experiences from the community, experiences from the system, and data about what's going on, and infuse that with dialogue. And I think the facilitation of this sort of work is really critical. There are a variety of different tools and techniques people can use in addition to just being seasoned facilitators. But one that we've found super powerful in developing both guiding principles and the beginnings of actually developing a goal is the method of appreciative inquiry. And some may be familiar with that process. There's plenty of information online about appreciative inquiry, but it's essentially a discipline of thinking in a sort of a strength-based way about envisioning positive futures. And two sort of questions within appreciative inquiry that we find super powerful that help set guiding principles and also beginning the thinking about what a goal is first ask people about their peak experiences of, when things have worked really well. When have they worked really well around collaboration, for example? And that's a great sort of question to engage people on that can elicit ultimately some of the guiding principles that people find really super valuable. And the second is a question about sort of helping people to imagine a future where, they aren't confronted and faced with the problems around the particular issue that they are today. There's lots more to sort of understanding how to do appreciative inquiry. It's actually a fairly simple process. There's plenty of information online, and there are many facilitators around really the world who do this sort of work. It can be very simple and powerful, but that's one methodology I might call out. One final question. Somebody asked, how is the process that we're outlining here, how is collective impact different from asset-based community development process, which uses many of the same methods, ABCD, community development process, asset-based community development process. And I think, for those who aren't familiar with ABCD, it lies in the premise that communities can drive the development process themselves by identifying and mobilizing existing but often unrecognized assets to, typically create economic opportunity. It's a community development approach. I think there are many, many similarities. The core of asset-based community development is a focus on social relationships. That is very important and core to collective impact. I think perhaps, one way to think about asset-based community development relative to collective impact is that, they're complementary. There are different aspects that are emphasized that can be valuable to both. ABCD tends to focus really strongly on the community and social relationships, but also acknowledges that you need system players involved, and collective impact would suggest the same thing. Collective impact highlights areas like the backbone, the need to have a set of resources whose sole purpose is the alignment and coordination of everybody else, and also areas like shared measurement. Again, these are in different ways, shapes, and forms articulated in asset-based community development. So the short answer to the question is there are quite a few similarities, some different levels of emphasis that you'll see in one versus the other, but I would say that they're both super valuable frameworks for thinking about large-scale sustainable change. So with that, we are going to move on to our next area, and which is defining a framework for change, and I'll turn it back to Abby.
Great, thanks, John. So how do you build your framework for change? First, I wanted to define what we mean by framework of change. We mean here simply your approach to the problem. It's a framework that allows you to start setting up either your working groups, if you are choosing to do that, or at least to organize yourselves around how you're going to go about tackling the problem. We often use sort of colloquially, we say, this is your decision about how you're going to chunk up the problem into pieces that are manageable so that you can start working on them. So a few sort of reflections on this process that we'll start with. One is that we recommend prioritizing the strategies you want to work on first. And I highlight the word first here because one of the toughest parts about this part of the process is the desire to want to do a bit of everything. And people will have a variety of ideas on what strategies might help address the specific problem that they've decided to work on. But there might be some things that they can address today really well and some things that they realize that might be better done in the future. So we recommend not trying to start driving forward all strategies at the same time, but rather to think about where is the best starting point in terms of the strategies that we want to work on. Second, to the degree that this is going to be helping you decide on working groups, it's really helpful to think about building your groups for action. And what I mean by that is that there's a number of different ways you could assign or decide on what to call a working group. For example, we had a group that was thinking about all the different strategies that they could do for diabetes prevention. And they said, it looks like we need a policy group because there's school policies we want to change, there's municipal policies we want to change, there's a variety of health policies we'd like to change to address that issue. And one of the questions we asked the group is, could you imagine getting a group of people in a room, say 10 to 12 people, that could work on that chunk of the problem? And what we ended up coming to realization is that actually school policies, municipal policies, federal policies, health policies are all distinct groups of people, and we said, where within that group might we really want to focus? And does it make sense to get the school folks in the room with the municipal policy, or is that distracting? So rather than making the groups around a specific topic, we tried to form groups where we could imagine those groups taking action together. So that's one common mistake we actually see people running into. Thirdly, I think this is the part where it's important to respect that this is both an art and a science. I'll speak to the science part first and then the art part. So we recommend that when groups are developing their framework for change, that they are based on the science and the evidence base that is available for them in working in their particular topics. So that is to say, throughout the Common Agenda process, there should be a reliance on looking at your local data and also, when possible, looking at other communities who have addressed the same issue and saying, what can we learn from them and what is out there in the literature that might guide us to what the appropriate and most effective strategies might be for us. So that's one part. At the same time, it's really important to then balance that focus on the science with where there is energy within the community to want to tackle specific parts of this problem. So there might be places where there are great evidence-based strategies that the community members and community leaders say, we're just not super enthused about doing that. We don't feel that that's going to work right now in our community. And that's really important data. And so having this sort of understanding that this isn't going to be a perfectly scientific process and it really needs to balance sort of where there's energy and momentum is critically important to setting up this process. So I'll walk you through an example, again, on how a group would form a working group structure from Unidos Contra Diabetes. This is their ultimate framework for change that they came up with, but I'll begin by telling you how they developed this. So we had 30 steering committee members who had, by this point, decided they were going to focus on diabetes prevention, they were going to focus on it in a holistic way, and they had their guiding principles assigned. What we had them do was review some evidence about some case studies of other communities that had done diabetes prevention efforts at the community level. So they reviewed that. We also had them do focus groups with community members who were either at risk for or had diabetes to ask for their input on what could be different in their communities to have had them prevent diabetes. We then came together and as a group brainstormed all the different kinds of strategies that might be possible to do at the community level. This group came up with 200 unique ideas of things that could be done at the community level to prevent diabetes. As a group, we began to say, where are there similar themes in these ideas? So we eventually condensed their 200 unique ideas into 10 themes. We then had the group look at the 10 themes and say, which of these are you most excited about starting on now? Do you think we could be successful with today? And they ended up choosing these 4 working groups as places to start. So the 4 working groups they chose were, 1, using media to engage the community broadly to raise awareness of diabetes and create a culture of health. That's the first working group. It's really about that broad awareness of diabetes so that people who might be at risk for diabetes, it's about making sure that people are aware of that risk factors and what they can do to prevent diabetes. The second group was around increasing screening and testing. So that was about making sure that people who might be at risk for diabetes are screened and know that if they are pre-diabetic, for example. A third group was about making sure that people who are screened and they do find out that they might have pre-diabetes, that there are meaningful and effective programs for them to be part of in their community to help them make the lifestyle changes that they need to make in order to prevent diabetes. The fourth group was around integrating the medical system and making sure that there's more coordination between primary, hospital, and behavioral health care to help better serve the at-risk individuals and their families. So those are the 4 groups. What I think is important to note about them is the degree to which these 4 groups are, they're clearly understandable to the groups themselves, so they know when they might be stretching into the territory of what another group is doing. So they're helpful in that they provide the group the ability to say, I'm going to focus on this chunk of the problem because I know that there are other groups who are working on other parts of this issue that are important. And they all fit together is another important part. These are complementary groups in terms of the fact that they making sure that people are screened is complemented by making sure that people who are screened and test positive for prediabetes do have the lifestyle programs, et cetera. One other note, they also decided, and we've seen this quite commonly in their framework for change, to include a data task force. And the purpose of that group is, while they're not a working group in the sense that they're not developing new strategies, they said it would be really helpful for them and their sort of infrastructure for this effort to have a group of people who could help them research, compile, and interpret important data about their problem. So that ended up being some members of the steering committee, along with some community members who largely come from the research community and can help them make decisions about what data to use, how to use it, and they're sort of an advisory group that they could call on an ad hoc basis. We find that very helpful. A second group, and I'll be brief with this one, was just to show a different way of structuring things. This was the asthma group in Dallas that we mentioned. And they chose 4 working groups corresponding to 4 parts of the problem that they had seen in discovering their root causes of asthma. So they had one about reducing the asthma triggers in physical environments, another group about helping children access health care, another one about making sure that health care, that when they access it, is high quality and consistent, and a fourth one around helping equip children and families for asthma wellness, which is really about sort of health literacy. The fifth aspect of the common agenda that you might choose to include is a plan for learning and evaluation. And what we mean by this is simply a planned approach to how, going forward, you might evaluate your work and learn from that and course correct. We find that this is one of the elements that groups pay perhaps the least attention to, but we think it's an important one and want to highlight some opportunities for what can be done here. We think that the planning for learning and evaluation is an opportunity to incorporate some early thoughts on your shared measurement, on your shared measures for the group going forward. The shared measurement is one of the 5 elements of collective impact that John mentioned previously, and this can be a head start on starting to think about what do you measure to know if you've made any progress. It can be really helpful to start being able to wrestle with and noting the changes on different scales you might want to see. So it's starting to think about what is the short-term change that we want to see, how do we know if we're making progress in the short term, and what are the long-term changes we eventually want to see at the population level. So it's a way of starting to break down as a group what you expect to see in the short, medium, and long term. And thirdly, the point of doing this, again, is to strongly emphasize the role of data in helping the group learn and modify and adapt their strategies. So what would an approach to learning and evaluation look like? This is an early sketch from the diabetes effort that I mentioned, where they had decided on their working groups that they were going to do, and they said, what do we want to ultimately see in the next few years? The first is that they wanted in the short term to see an increase in healthy community and health behaviors. That is, they wanted to see transformations happening in the community in things like visibility of more bike paths. They also wanted to see increases in health behaviors that are related to diabetes. Those included healthy eating, exercise, and even getting appropriate primary care. They felt that those changes in the short term would help lead to a decrease in diabetes risk factors in the medium term. So that would be a decrease in obesity, a decrease in prediabetes. And they felt that that decrease in the risk factors would ultimately, in the long term, relate to the decrease in diabetes. So at this stage in developing the common agenda, the steering committee had a draft level of what the important indicators were in each of these categories that they wanted to collect and track and learn from over time. So that is the last and fifth of the elements. We wanted to ask your opinion about your process in developing the common agenda. So I will turn this back to John, who will launch the next poll.
Great. Thanks, Abby. So, yeah, as Abby said, we wanted to, now that we've walked through each of the items of developing a common agenda, guiding principles, boundaries or problem definition, overall goal, framework for change, and a plan for learning, we wanted to get your sense of what you think is the most challenging for steering committees to develop. Which of these 5? And a number of you are answering. I'm seeing the poll come up. And so far, it looks like about a third on guiding principles and a third on establishing the overall goals. I'm sorry. I actually read it wrong. It makes more sense now based on what I would have thought, that actually determining the boundaries and the problem definition appears to be coming out sort of at the highest, then developing a framework for change, and then lower levels of sort of difficulty around developing a plan for learning and the overall goal and guiding principles. So, yeah, I would say this is pretty consistent with our experience that, the boundaries of the problem and the framework for change are, the really tough parts of this work, because when we think about the boundaries and the problem definition, at some level, everything's connected to everything, and we can think about something like, if we're trying to achieve and improve health outcomes, and we know that in many instances can be related to whether or not people are living in, safe and affordable housing. So does housing then become part of how you're achieving, health outcomes? And so we're always going to sort of get into this of, what's in and what's out. And, I think, to a certain degree, it does depend on the local context and on what the stakeholders want to take on and how big or focus they want to sort of draw the circle. Adrian Abate, who's going to be talking in a minute, will talk a little bit about how the boundaries and problem definition were characterized in the Tackling Youth Substance Abuse initiative that she's been involved in leading up. And it is both art and science, as Abby said. And the framework for change, I think, also is super challenging. And Abby talked about a number of ways of trying to bring data together to help understand how you want to chunk up the problem. It's really looking at information about what's going on in your community, and also looking, importantly, at what has worked, and how folks have looked at this in other communities and what we can learn from that and what we can learn from evidence-based practices that are out there. And somebody had actually asked the question, shouldn't we also be including what's been tried and what's failed in terms of how we might organize to address the problem? And absolutely. So again, it's a matter of bringing together the data that you can bring together that can form the decision, and starting with what you feel is a good enough start. The framework for change, interestingly enough, in my experience, if a group is doing the work well, the framework for change will evolve over time. If it's static, it's less likely that you're actually sort of tracking with the issue and responding to what's going on. Great. So with that, we're going to move on to sort of looking at a common agenda. We've taken you through each of these 5 items, but we thought it might be helpful to actually look at a common agenda as a whole. And we're delighted again that Adrian Abate from Staten Island has joined us to share her experiences with the Tackling Youth Substance Abuse initiative that Adrian is leading up as executive director. So with Adrian, I'll turn it over to you.
Okay, thank you, John and Abby. So you heard a little bit about tackling youth substance abuse, but just a little more background. We were formed in 2011 with generous funding from the Staten Island Foundation to collectively address youth substance abuse issues. And we have an interesting genesis story in that it was actually the foundation who learned about collective impact and brought the concept to the leadership of the Staten Island Partnership for Community Wellness. So we are the backbone. We weren't the backbone then. We were just an organization that was already using a collaborative approach to address local community health needs. So this speaks a little bit to one of the earlier questions, do you have to have a backbone in place? Not necessarily, but there was already a group of stakeholders meeting, working on some of these issues. There was a real effort to understand collective impact and get buy-in from local leadership, and then use community-level data to determine which of our initiatives to align around. And from the statistics and the growing concern from the community, it became clear that youth substance abuse was the most pressing health concern impacting our youth. And just a little bit more background, Staten Island is a borough of New York City and a county. Right. So once our issue was defined, we started to think about the layers of influence that can impact whether a youth might misuse substances, starting with the individual, family, expanding to community, and then larger systems. And this guided our cross-sector stakeholder engagement process so that we could fully understand the extent of the issue, but then also to find out the perspective and current efforts of all of the different players. And when I say cross-sector stakeholder engagement, we identified and engaged leadership from New York Police Department, from our district attorney's office, from the treatment professionals, from faith-based organizations, from businesses. We had the paper involved. So again, we cast a broad net because we realized that many different systems influence youth substance abuse. And in the formation of our common agenda, we conducted focus groups, we did key informant interviews and meetings with over 60 individuals, not only from Staten Island, but also partners across New York City and New York State, and then also reaching out to other communities working on similar issues across the country. We also, again, the idea of having the systems in the room, we realized we could not have an initiative about youth without the youth voice. So although we didn't have a youth council established or, we were not setting that up initially, but we always had youth focus groups and the youth perspective. And now a couple of years down the road, we have an established youth arm of the initiative. TYSA identified guiding principles that represented the core values and defined how we were going to work together. The first one was that we were looking at dramatic population-level outcomes, so real shifts in youth behavior for the entire county. The second piece was that we were looking at structural changes. We wanted to see where there were breakdowns between systems and how we could work together to address. From the onset, we were thinking about sustainability. How do we integrate the work into the current systems so that our efforts don't disappear in the absence of funding? And then finally, all strategies were to be rooted in research and have evidence of success. Okay, great. So once we had our guiding principles and the commitment to focus on substance abuse, we needed to do some work on defining the problem. Substance abuse is influenced by a host of factors, right? It could be school completion, domestic violence. We also needed to hone in on what particular subjects or substances that we were going to focus on specifically. And as we learned more about our community issues from the interviews and focus groups and surveillance data, it helped us to gain focus, get clarity, and make calls about what our current priorities should be. And again, I can highlight the boxed and shaded and dotted lines, what our current priorities would be and what might be coming down the pike. So, for example, we knew that mental health greatly influences and impacts substance abuse issues, but it was not going to be our current priority, but we identified it as something to revisit 3 to 5 years into the initiative. We also knew that there was a lot of alignment between mental health and substance abuse happening at the state and federal level that we were keeping tabs on, but again, for our initial focus, we looked at very specific definitions. So we were looking at alcohol, prescription drugs, and then some of the actual activities that we could, as a community, impact. And here are our goals. So our outcome goals are ambitious. We were seeking to reduce alcohol use and prescription opioid misuse among youth. And we landed on these two substances, again, based on the data. So compared to youth in New York City, youth on Staten Island were drinking at much higher rates. Of those youth, they were more likely to overconsume or binge drink, which is 4 or more or 5 or more drinks per session. And they were also much more likely to have reported using an opioid analgesic in their lifetime. Right, so we identified targets. Our 2020 targets were created New York City averages. So we had a time frame, we had a target, and we landed on population outcomes that were measurable, right? We identified measures that were being collected on a regular basis by our partners in the city and state. And again, initiatives can collect their own data, but if you can, this is an example of aligning efforts, right? Finding out what our partners are already collecting and how we can work together. So we mentioned earlier that youth do not make decisions about misusing substances in a vacuum. They're impacted by many layers of influence and the intersections of people, organizations, and systems.
And I was told to keep the slides simple, so I apologize for this next one, but it's all good information. So we started to look, when we were developing our common agenda, at other communities, and we conducted significant research on substance abuse prevention models. And what we found were that there were a series of risk and protective factors that go across all of the systems, and it might be difficult to read. But using our local conditions and community information, we were able to look at which assets we wanted to expand and what risks we wanted to decrease. We also kept in mind what we were able to actually influence. For example, you'll see in in the community level and systems change that increasing taxes is very impactful will influence behavior. But we knew that there was little political will and support for an alcohol tax. So again, when we were prioritizing issues and strategies, that came lower on the list. So as we began to better understand our community, look at the risk and protective factors, we use this information to organize, align efforts, and develop a framework for change. Okay. So our framework for change aligned with our local conditions and led to the formation of 4 work groups with strategies that cut across various systems. And the work groups report to a larger steering committee that is responsible for the overall direction of the initiative, but the actual strategies and implementation happen at the work group level. The first work group looked at social norms, right? And this looked at community attitudes and norms that influenced youth substance abuse in our community. From the focus groups, from working with all the different partners, we were hearing that parents felt that it was okay to provide alcohol to their youth, that they thought that they were providing a safe haven for kids to party. We heard from both youth and adults that there was a perception that prescription drugs were safe to share and to use, that we came from a culture of taking a pill to remedy our issues. So there was a very pill-centric culture. That parents were not having discussions with youth around any of these issues. So again, we had a work group that was looking specifically at shifting some of these norms and increasing the protective factors. We also learned from youth that alcohol and prescription drugs were readily available both in the homes and the community, thus creating an access issue. We had data that showed that compared to every other neighborhood in New York City and actually any other county in New York State, that the prescribers in our community were writing opioid analgesic prescriptions at a much higher rate for a longer duration and a higher dosage. So there was something happening in our community. We also heard from youth that they knew exactly where to go for alcohol, that many stores were not even carding them. So this work group was looking at strategies to encourage people to safeguard and dispose of medication. We worked with the health department and prescribers in our community to do training on judicious pain management. And we worked with retailers to prevent underage alcohol sales. Right? The third group looked at the full continuum of services in our community. So what we were hearing is that people who had issues didn't know where to go, that there were gaps in services. So what we did was we developed a work group that looked at the full continuum from prevention to early screening to referral to treatment to actual supporting recovery. And we said, what is the gold standard and what do we have in our community? And then how do we advocate for more services, which leads us to our next work group, which is policy and advocacy. And this group was convened to develop a policy platform that impacts availability, it impacts access to treatment, and any other facets of youth substance abuse. And that included legislation, but also organizational policies. And one example of that might be a hospital changing their prescribing policies, or one of our favorite success stories is NYPD carrying a medication to reverse overdose deaths. Right, this all came out of one of our work groups. Okay. So I mentioned earlier that TYSA is really rooted in evaluation and collective learning. Once our work groups were established, they set about identifying measures to track the success of the strategies and also to identify potential data sources. And it might be difficult to read, but again, looking at an example of social norms, the percent of youth who agree that they feel connected to at least one teacher or adult in their school. Well, that's tracked through a youth development survey that's implemented by the state. So again, we were tying strategies or identifying strategies that were aligned to our theory of change, looking for indicators to measure success, but then also really thinking about data sources, because if you have to create methods to collect data, it's possible, but it's a heavier lift. So looking to really understand what's available in the community, I think, is an important lesson. We also realized that our population health outcomes, that we wouldn't really see any shift in the outcomes for at least 5 years. So we were curious as a coalition to look at our accomplishments working together collaboratively. And you'll see that pie chart on the right. And what we were trying to look at is, we've been working together through work groups, but what are these process and intermediary outputs? What do they look like, and how do we show how they contribute to change? So again, just an example here, we were looking at when we go out and deliver services, when there are workshops provided, when we generate media both for the issue or for the initiative, when a new program is implemented within one of our systems, that's a system change. And lastly, when we talk about collective learning, we instituted this past January, we conducted a refresh and a strategic planning session, and FSG actually came in to help us to reflect on our accomplishments, to revisit some of the data trends, and to identify potential changes to our theory of change and common agenda. So we stepped back. We actually did accomplish a lot in 3 years, and we noticed that there were new and emerging issues, which we expected, right? And we always, when we set out to do this work, we said we have to be flexible to respond to emerging issues. So now, as a result of the work that we did this past January, we've expanded the target age of our initiative to 25 to young adults. We have included heroin as an emerging issue and have created an ad hoc work group to inform the other standing work groups. And we have included overdose prevention strategies in our efforts. So the idea is that we are collectively learning and refining our agenda based on data and lessons learned, and it's really a living document. And lastly, this is the most exciting slide, is that we're starting to see outcomes and systems change earlier than our goal of 2020. So between 2008 and 2014, prescription painkiller use decreased by 83% among 7th to 12th graders. And this, is amazing on many levels, but, the youth who were using in 2008 the prescription painkillers have now grown into the young adults who are using heroin. Epidemic among our young adult and adult populations in our community, but what we're seeing with the decreased use among the current 7th to 12th graders, that if we can maintain this, that these are real protective factors in terms of future heroin use. And then the other outcome, between 2011 and 2013, opioid overdose deaths in Staten Island decreased 32%. So among Staten Island residents, even though they were increasing across New York City. And what you didn't see, I didn't show the slide, but compared to all the other boroughs, our rate of overdose deaths had increased dramatically from 2006. So the fact that we're now on a downward trend is really encouraging, but it just reiterates that we have to continue these efforts and actually double up our efforts, because this is a real issue. Okay. And then some of our other results are the positive partner feedback. So TYSA validated this issue. It made it not just one person's problem, but everybody's problem. And this was a huge issue. When we first started to do the work, nobody would come out to workshops. There was very stigmatizing. People did not want anybody knowing their business. They felt like they could work on the issue on their own. So we really shifted community attitudes and ownership of the problem. In over 30 years of working across New York, I've never seen this kind of collaboration, and this was from one of our government partners. And we've been invited to talk about coalition formation and systems change, not only with other groups in New York City, but across New York State. Okay. And again, people felt, and this is having ownership of the issue and having a role in it, that they were making a difference, and that they were part of a collaborative that was actually saving lives. And that I hear hope when I'm talking to parents and grandparents on Staten Island. I don't hear despair, and that is because of TYSA. So those are some of the wonderful outcomes that we've experienced due to this effort, and it was because so many different groups took ownership of the issue and came together and worked on identifying a shared vision of addressing it together.
Great. Adrian, that's a great story, and thanks so much for sharing it. Can we flip to the next slide? So if we could, roll this out. We're going to go into Q&A in a second, but this is just a reminder of the 5 areas that we've talked about that are core to a common agenda: guiding principles, defining the boundaries and the problem definition, the goal, a framework for change, and a plan for learning. So now we've got about 15 minutes or so where we can address some of the questions that have come up. And let me start, Adrienne. I'm going to come right back to you. And there's a great question, and you sort of talked a bit about in some of the decisions that were made in the common agenda and how that's evolved over time. Here's a question: how do you balance audaciousness and reality as you're thinking about developing a common agenda?
Well, that is a great question. I mean, I think that we selected audacious outcomes to inspire the stakeholder groups and partners, because it wasn't just, a modest decrease. It was, how do we really move the needle on an important subject? But again, I think I tried to balance it by saying that we were looking at what data were already being collected and tracked. So that was a little bit of a combination, having an audacious target but having a realistic data source.
Right. And when you look at the results that you've achieved, in some respects, I'm guessing, well, having been there, I know that, when we set out these goals at the beginning, when you all set out these goals, you could not have imagined probably that you'd see the level of results in terms of decline in prescription painkillers and decrease in opioid deaths in this reasonably short period that you have. So in some respects, audacious results, even though you've been fairly realistic in terms of thinking about what could be accomplished. Yeah.
Yes.
Good. Great. Abby, here's a question that came up when you were sharing the framework for change and chunking things up. I have some perspectives on this too, but the question is, when you think about the different strategies that were presented in the framework for change, how is that different than when we talk about mutually reinforcing activities? How are the strategies different than mutually reinforcing activities that were presented?
Oh, great question. Thanks, John. I think it's a wonderful question because I think they are very much the same thing. I think that the framework for change is a structure that allows for the mutually reinforcing activities to roll out and to happen. And I think that the working group structure also fits within, of course, is sort of operating within context of the steering committee continuing to meet, and the steering committee can play a really helpful role in helping identify areas where working groups might be looking at issues that are related or similar, and they can, and the steering committee can provide some helpful guidance on how they might sort of better coordinate their action and sort of really help reinforce that idea of the mutually reinforcing activities.
Yeah, and I think another way to think about answering or addressing that question is that there are typically, we're talking about sort of multiple levels of mutual reinforcement. At the framework for change level, you're looking at mutually reinforcing strategies. So, for example, if we were talking about addressing childhood obesity, you might have strategies that address, helping people eat healthier, better nutrition, strategies that address physical activity and exercise, and helping people become more fit, if you will, and a third area that's around sort of addressing the physical infrastructure in a city so that people have more access to, for example, parks, et cetera. And so we're looking for mutually reinforcing strategies. Nutrition, exercise, addressing physical infrastructure, those would be mutually reinforcing. And then within each of those areas, there are activities that would take place. As an example, in the Child Obesity Prevention Initiative that Abby and I worked with, in Dallas, one of the activities within the area of thinking about more nutritious food was in areas of the city that were food deserts, where there wasn't great access to healthy food, was an initiative around supporting corner stores that typically don't carry healthy foods, that might carry, mostly salty snacks and other things, helping corner stores carry fresh foods. So that would be an activity within the nutrition bucket, if you will. But then there are other activities that would work in mutually reinforcing ways with more access to healthier food through corner stores. Activities such as helping families through, training, better understand what food is healthy and how to actually cook healthy food. And you might locate training classes in, public housing that's near those corner stores. So those would be mutually reinforcing activities or sub-strategies that are within, a context or a structure of mutually reinforcing strategies at a higher level. And so I think we typically see the need for mutual reinforcement playing out at multiple levels and multiple layers of the work. So, Adrian, when you talked throughout, when you were talking about sort of the development of the Common Agenda and even the evolution of the Common Agenda, and you used the word we, and there was a question of, who is the we? Who initially decided? Who is the we that decided on the boundaries, and who is the we that you're talking about in terms of evolving things?
So the we was it was even before we were called the steering committee. It was the group of dedicated partners. It was led by the Staten Island Partnership for Community Wellness Board and some of our typical partners. But as we started to engage stakeholders, it was the beginning of the steering committee before we were calling ourselves the steering committee. And the idea was that it was not a single group of people making decisions on a phone call or behind closed doors, but we were bringing information to, a smaller group was bringing information to the larger steering committee to make decisions. So doing research on other communities, looking at other models, looking at our statistics and community level information and presenting it to the group to make decisions. Until we landed kind of on our theory of change, and then we recruited for specific backbone staff. But for a while, it was a very small, executive committee of the larger steering committee that was serving as the backbone with support from FSG.
Yeah, great, good. And here's another both observation and question, I guess. Somebody's pointing out that in their CI work, and there's just a big shout-out of thank you to the person who put this, Emily Blake, that they've experienced in the work you're bringing diverse groups of people together, and that, as a diverse group trying to solve a problem together, they experience, the sort of team formation stages of forming first and then storming, which means not getting along, and then norming over time. And a little bit surprised that hasn't been mentioned yet. And I'm wondering if either Adrian or Abby, if I would agree with that's something. And I think the other statement was that knowing that as a group you're going to move through those stages can sometimes be helpful. And I wonder if Adrian or Abby, you have any experiences that might sort of mirror or reflect that as well.
Sure, absolutely. I'll add a few thoughts and then let Adrian contribute as well. I would say that as we went through the different parts of the Common Agenda, one thing is that those were not single point in time decisions. And I think any of these decisions about what the boundaries are, what the goal is, we generally see groups, initially doing some brainstorming about what the answer could be, coming back, refining their work and putting an initial stake in the ground, and then coming back again and saying, do we feel comfortable with that decision? So I think allowing people that time to have sort of some iteration, to speak with each other in between about that, was really a helpful part of kind of the Common Agenda process for them. So the iterative nature, I think, is a huge part of it. I also think that starting with some decisions like the guiding principles, as many of you said in the poll, that you thought the guiding principles would be something that would be on the easier side. I think that's probably true. And that allows people to have a little bit of practice in what the group dynamics are in making a decision. And then they progressively get to decisions that have more and more sort of consequences or impact or feel like they could be harder, but they now have a little bit more trust and practice in doing that.
I would agree, and just add that having the guiding principles was really helpful in keeping people on track, and we did have some issues identifying the substances to focus on. People specifically just wanted to look at opioids, prescription drugs in general, and not alcohol, but we said, we're rooted in data and evidence-based, and if we look at our statistics, alcohol is the number one substance being abused by not only youth, but adults in our community, so we really can't ignore it. And that helped with problem definition, just going back to our core values and principles.
Yep, great. So here's another question or observation. On a more macro level, this person says they've seen examples of where, the question is, on a more macro level, have we seen examples of where collective impact efforts have started with continuous communication? And in their particular instance, the backbone decided to put off developing the common agenda until, trust was built and people were communicating and communicating more transparently. Abby, any thoughts on that?
Yeah, absolutely. I would say that there is a huge amount of pre-work that can happen before there's readiness for a community to even launch a steering committee and get into the process of defining the common agenda. And the prior webinars in this series have definitely talked about some of those conditions, but we have certainly seen communities where there have been conversations happening to build urgency around a particular issue and to also build trust between potential collaborators for months, if not years, before they feel like they're at the point where they're ready to really launch a collective impact initiative. They have sort of that urgency, they have the champions ready, they have funding ready, and they're ready to begin the process of a common agenda. So I think it's an excellent question, and would definitely also reference and refer to some of the prior webinars that have dealt with that exact issue.
Yeah, and a number of questions have come up about engaging the community and transparency and trust. And I would refer people to, I think it was the previous seminar to this, or webinar to this, where we talked at length about sort of different strategies for engaging the community and different reasons why, and really understanding that this is about sustaining change within the community and not doing it to the community. I think most people who do this work understand that at this point, but it's still, of course, a challenge. And the various different ways to ensure inclusive decision making, and that this is an effort that includes both residents and professionals, and really, has a variety of ways that the community is involved, from really testing and piloting strategies to being part of, the work groups and the steering committees to really, in many instances, being, significant leaders of the effort and, engaging many others along the way. So, good. Let's see. Other questions. Abby, one question that came up around boundaries was, how do we think about geography? What's too big and, what's not big enough?
Yeah,
what do you think?
It's a great question and an age-old one in some ways. I think that the answer to that is that it really depends on the problem at hand to decide what geography is going to be too big. So there are initiatives like we've seen where the zip code level collective impact initiative is the right geographic size, and any bigger would not make sense. And the reason for that is that to get the people in the room who can work meaningfully to address change in that community, it requires sort of an in-depth, deep relationships being built by people from different sectors in a particular area. There are other issues where we've seen collective impact efforts effectively tackle state-level issues. A great example of that is one called, on the New York juvenile justice system, did a phenomenal job reforming the juvenile justice system at a state level, and I think what made a state the right geographic scope for that type of initiative was that many of the issues that they were dealing with were in fact state-level issues. Many of them were state-level policies is what they wanted to change. And also the players that they wanted to get in the room that represented the various sectors could be put together and brought together on that specific issue at a state level. So I don't think there's any defined rules here on what's too big. I haven't, and John and Adrian welcome any comments here on this, but I have not seen sort of hallmark collective impact examples that are tackling issues at a broader than a state level. I'd say, at least if they are, they're few and far between. And in many cases, we find that some of the issues are sort of within the county or a couple of county issues. So it's a bit of a case-by-case answer, I would say.
Yeah, and I would just add that, we're looking at outcome data for the county level, but the strategies are customized for different neighborhoods and communities because we realize that there are different factors, social determinants, like there are a whole host of issues that vary across the borough of Staten Island, so we need to customize our efforts and really understand the issue and adapt.
Yeah, that's great. And that's maybe a good segue into this question, which is how do you balance the process of ensuring collective learning when defining problems and boundaries and the need to make progress and make decisions and keep people engaged? So this whole notion of we're going to be engaging, dozens, if not hundreds of organizations and thousands of individuals, and how can we actually, in that environment or in that set of conditions, how do we actually, ensure and engage in collective learning? Thoughts from either of you? Well, I'll weigh in here.
Okay.
Yeah. Go ahead.
No. I was just going to say, we do collective learning all the time, and we try to be transparent with the work that we're doing and share outcomes so that every member of the initiative is on the same page. And when we propose decisions about changes to the theory of change or the agenda, that everybody feels that they understand why we're coming at it from that angle, and that they are informed enough to make a decision to weigh in and impact it.
And I'll add to that, Don, too. I would say one of the things that we've tried to do in the efforts we've been involved in is ensure that there's some aspect of learning every time that the group comes together. And there's a variety of ways in which we do that, but you can have members of the steering committee or of working groups bring information about their work, what they've been doing, and that sort of is a key component in sort of the agenda setting, really, in each meeting. And then how do you balance that with sort of then the making progress? I think one of the things that I like to keep in mind is that the how of making decisions is more important often than the what and the when. And so making sure that when people come to a decision, it feels like it's made in a way that people understand the issue, that they feel really good about their collective decision that they've made, and it feels comfortable with the group's guiding principles in terms of they feel in line with who they are and who they want to be, I think is really important. And if they can't come to a decision in a meeting because you scheduled it that time, I think it's critically important to have the flexibility and in those timelines so that you are not forcing groups to come to decisions before they're ready. And that's the kind of flexible aspect of this work.
Great. Terrific. Well, we're going to move to final thoughts. Thank you both for your answers to those questions. And we have a couple of minutes for all of us to provide some closing thoughts of advice for the group today. Abby, why don't we start with you?
One of the questions that came through on the chat relates to my final thoughts here, which is who is the we in these decisions? And the we that we have been speaking about is generally the steering committee or a pre-steering committee for these efforts. And I think in practice who that is are often system leaders and community members who have not previously worked together and may not even know each other and represent different kinds of expertise and different types of interactions in sort of the problem. And I think that what's most important about this common agenda process that we've been talking about is the formation of the we. And it's the bringing people together who don't know each other, have not worked together, and yet building collective learning, and then that collective capacity to make some decisions together that is the most important part of this common agenda process.
Great. Thanks, Abby. Adrian?
Yeah, this also builds on the we. I didn't speak too much about the steering committee for TYSA, but it's pretty high level. It's people who can affect change within organizations. But then the mixture of having the community voice in the mix and informing decisions. So for us, the most important thing is to have still high-level participation, but make sure that through the work groups and through focus groups and through participation at the steering committee, that emerging community health needs, that health disparities are addressed, the things that we didn't identify earlier on are now accounted for so that we can continuously modify and reflect and meet the needs of the community.
Great, and I'll just add to that, we've talked a lot of content today, but as I said at the beginning, at the end of the day, what's most valuable in this, picking up on Abby and Adrian's comments, is really the process of bringing the collective we together to engage in this and being structured and rigorous in that approach. So with that, I'll turn it back to Sherry, who will close us out.
Great. Thanks, John. And I wanted to say thank you to the audience and participants for joining us today for collaborating to create a common agenda. We hope you enjoyed the presentations. And a special thank you to our panelists today, Adrian Abate of Staten Island Partnership for Community Wellness and John Kenya and Abigail Stevenson of FSG. You can find today's PowerPoint slides and handout materials on the collectiveimpactforum.org. You will also be receiving an email with direct links shortly. Join the forum for access to even more information, materials, and networks around collective impact. And we're also going to ask you to take a moment to complete the evaluation that will appear on your screen momentarily. Your comments and suggestions are important to us as we, as they help us adjust our programming to fit your needs. Thanks again for joining us, and we look forward to continuing the conversation in the future.